Welcome to Coffee with Qamar. I'm Dr. Qamar Khan. I'm a nephrologist practicing in United States. We have Dr. Sohail Chuktai in our uh, studio today. He's an orthopedic surgeon practicing in London. He's a software engineer, and he has been working on telehealth for last 20 years, both like delivering telehealth and teaching telehealth. So so let's just dive right in, and we have Dr. Sohail Chuktai here. So I'll ask you, Dr. Chuktai, to talk about your involvement in the telehealth uh, projects, and let's just hear from you.
Thank you, Dr. Qamar. I have enjoyed your last program, and I think you pretty much covered a good deal of content in the last program. But I just want to take it from where we left. Uh, my involvement with telehealth is at four levels. First of all, as a consultancy level, where I have been advising various large institutions, including Government of Pakistan, Health Department, and provincial, and also at the federal level, that what, in my view, would help plug the gap of service. Where there is gap of service, and we do not have resources to plug the gap of service, telehealth can bridge that gap. So my first role is telehealth consultancy to plug the gaps of service in healthcare. The second role is designing a software, telehealth software, based on where the needs can be filled. So that is the second part, designing telehealth software. And I've
Mhm.
designed more than 40 telehealth software, general telemedicine, specialized telemedicine, super specialized telemedicine like telepathology, teleradiology, and then training software, online training for doctors, and various other modalities. Also, how to do teleward round together, and there's then how to supervise surgery in theaters. So there are more than 23 software being deployed in 40 different projects in the last few years of my telehealth career. So this is a second role. And the third role I play in telehealth involvement is the training, the training of the doctors, that how to use telehealth software to the most effective degree. And that sometimes is just software training. And at times, this can go into software certification, that where doctors can be certified as certified telehealth clinicians and certified telehealth coordinators, people who want to help doctors, like nurses, like technicians.
Mhm.
So that is the third part, where I've been helped by Professor Dr. Javed Akram in Pakistan, who is the Vice Chancellor of the University of Health Sciences, to
Mhm.
help me set up a department of telehealth at the University of Health Sciences, Lahore. We are running telehealth certification programs, and one of them is a master degree program as well. And the last role of my involvement in telehealth is basically the first role was consultancy, the second was software creation, the third was training, and the fourth is deployment. How to set up teams for software deployment, how to make an operation structure where everybody knows what to do. So these four roles, the software consultancy, telehealth consultancy, then telehealth software designing, then telehealth software training, and then telehealth software projects admin or deployment. That is where I have put my 20 years of my life into it.
Wow, that's amazing. I mean, I think that this is a era where doctors who don't keep up with the technology, I mean, they are the one who will probably disappear, and the one who embrace it, and they're going to be able to provide the best care. So now I'm going to go to the next question, and ask you to tell us about your project with Pakistan government that you have recently been involved, and how it is going to help uh, improve delivery to the Pakistan healthcare system.
I have been working with Pakistan government since March 2020. And that is the time when Pakistan Prime Minister Imran Khan on the 12th of March announced a lockdown. And maybe I can show you some pictures while we are talking, that
Sure.
how did this happen? The 12th of March, I was doing a press conference in Lahore at Pakistan Society of Internal Medicine conference, where I suggested Pakistan government to have telemedicine deployed so that people do not rush out
Hmm.
during the lockdown.
Hmm.
Because the only condition people can break the lockdown was to get essential foods and essential services like healthcare. So
Right.
imagine if the patients had gone outside during lockdown, there would have been
Hmm.
a massive movement in clinics. So I
Right.
wanted to minimize that. So I suggested the government of Pakistan to deploy telemedicine so
Hmm.
that people from their homes can be examined by a doctor for basic medical advice.
Sure.
Before I reached the airport, I was flying back to London the same night as the flights were. That was the last flight to London that night after the airport was shut down.
Interesting.
So on the airport, I received the information from official channels that Pakistani
Right.
government is interested to set up a telemedicine helpline, and I managed to instruct my software developers before the flight took off to modify one of my software in the next few hours. So by the time I reached London, I had a draft presented to me while I was moving back from airport to home.
Hmm.
So on my mobile, I still remember on my mobile on WhatsApp, I was watching the screens and I was saying okay, not okay, and that kind of.
That's
And
interesting.
then in the next 48 hours, we were practicing. And then in 3 days' time, the governor of Punjab, Chaudhry Mohammed Sarwar, inaugurated that national telemedicine helpline at the University of Health Sciences. And you can see in the pictures as well. So that exercise was enormous because it eventually involved several medical institutions who were giving us that satellite hubs where doctors can start seeing the patients. And the calls came from all over the country. And then eventually 17 countries where Pakistanis were there, they called us. And then we had some calls from India as well. People who could speak the same language, they could call and take advice from the doctor sitting on the telemedicine helpline. So that brought not only benefit to the patients, but a culture of telemedicine.
Yes.
Because then it was forced onto people to use a means of seeing a doctor. Before they had choice, but now they didn't have any choice. So it was a
Right.
kind of a necessitated learning,
Right.
which kind of which was like a process of unlearning and
Hmm.
relearning something new, and that worked. People learned how to see a doctor despite not without leaving home. So that cultural change, mindset
Yeah.
change, was equally important. That is one of my projects, and then this thing rolled on and on. And I remember after that we started 3 or 4 projects for the government of Punjab.
Hmm.
One was called Sehat Ghar, and you can see on the screen that website sehatghar
Yes.
online, which was for 110 million people of Punjab. Then we started Tele Ward Round in Jinnah Hospital, Lahore,
Hmm.
from London. That was featured by BBC, as maybe I can show you that small clip of
Sure.
BBC in the next few minutes.
That would be. Yeah. I mean, it has been amazing, and yeah, that clip is tells you a lot, and so let's just go to the next topic. You have also been involved in helping hospitals like Indus and even military CMH. So, do you want to tell us a little bit more about those projects?
Uh, Telemedicine is basically applicable to all sectors of service, whether it's military, whether it's public domain, whether it's private domain. In military, we have been kindly invited by the Vice Chancellor of NUMS, National
Mhm.
University of Medical Sciences, Rawalpindi, and Power 100, a very prominent group from USA, where Dr. Khan, you're also involved. They had facilitated this move. So I was invited by the VC, Lieutenant General Imran Majid,
Mhm.
where I demonstrated a kind of a trilateral project of
Mhm.
teaching, uh, then clinical consultations, and then medical education through a TV channel, a medical TV channel. So that tri-pronged project is being considered by NUMS at the moment. And we have given the demo and we're ready for the pilot. For
Mhm.
Indus Hospital, there's a different model. Indus Hospital model is that they wanted their own software to be embedded within a telehealth service, like their own electronic medical record system to be embedded within a telehealth service. So we had done some work with them, and
Mhm.
we are planning more eventually in future to connect remote Indus Hospital clinics to the main server. main hospital somewhere. More interestingly, I want to mention what Dr. Faisal Sultan, the Pakistan Federal Health Minister, uh, he actually had a meeting with him last week, and we had decided to install tele-ward round,
Mhm.
tele-supervision of surgery, and then teleconsultations in 6 hospitals of Islamabad. So that operation is most likely to involve 48 consultants from UK and USA who will be in the roster to provide these services to 6 hospitals in Islamabad. And there will be a trolley, a telehealth trolley with
Mhm.
6 7 devices attached to it, which are merged within my telemedicine software to move from patient to patient or in clinics or in theaters. It'll be like a moving a clinic. So,
Right.
the important concept to understand is if you can control the technology at the patient end, technology and training, then you can bring any doctor in the world at that point. Any doctor in the world at that point, if you can control the technology
Mm.
at the patient's end.
Right. And
This is
and
what we're trying to achieve.
sure. And who would do better than you? I mean, you're a Microsoft certified Microsoft engineer and a physician. So you have, like, pretty much what is best for the physicians as well as patients. So moving on to the next like question that we recently, your te- telehealth system, you have a doctor 24/7, and that has provided some commendable service to not only people in Pakistan with the second spike, but other countries also. And also, you also took or delivered care in Palestine. You want to tell us a little bit more about these things?
That's again an example for how telemedicine can really help reach out to patients, to doctors,
Hmm.
where doctors are really deficient or not available. For example, in Gaza, after the recent calamity which happened, there was a shortage of doctors. So at University of Health Sciences, I spoke to Professor Dr. Javed Akram,
Hmm.
and we decided that we should offer this to the people in Gaza.
Hmm.
And we engaged the Red Crescent in Egypt and
Hmm.
also Red Crescent in Jordan.
Hmm.
They facilitated the whole deal. Then we involved the Palestinian ambassador in Islamabad as well, Professor Dr. Javed Akram and Dr. Khurram Shahzad in Pakistan from Citrus Health played a good role in that. So they helped me coordinate with them, and then eventually what we did was that I was doing fracture clinic
Hmm.
in Gaza, and I showed that how can we save your X-rays if
Hmm.
there's any loss of X-rays. When I examine a patient, I can save the X-ray, and I can probably show you that clip when I did a small teleconsultation. So let me share that
Yeah,
clip with
please
you right.
do. Yeah.
As you
Yeah,
can see in this clip, I'm saving the X-ray for that doctor. So
mhm.
which if that patient comes back to me again, that wrist fracture I examined, I can follow up from where I left.
Yeah. That's really wonderful, amazing, amazing. This really tells you that, I mean, there are no boundaries and there are no limitations anymore. I mean, you can provide healthcare from anywhere to anywhere to anyone. One, I mean, we talked about your doctor 24/7, and just tell us about the volunteer physicians that you were able to recruit for this amazing project.
Uh, we had difficulty initially to get the doctors when we started Doctors 24/7 project, National Telemedicine Helpline in Pakistan in March 2020. But then University Health Sciences, they came up and Professor Dr. Javed Akram announced the CME, the Continuous Medical Education hours for those doctors who volunteer.
Hmm.
So doctors came up in large numbers, and then we were able to recruit them. Up to 530 doctors were routed through the 6 months project,
Wow,
and they
that's
were all volunteers.
amazing.
And then the next step was the Pakistan Poverty Alleviation Fund, PPAF, Mr. Qazi Isa, he's the chairman of that. He came up and he said, we want to deploy this in different parts of the country where the healthcare is very, very minimal and people don't have money. So that was a funded project where we were able to pay the doctors through the funds we got from the government. That was a project which started March 2020, January 2021, and finished in April 2021. And that was a funded project where we could pay the doctors. Maybe I can
Mhm.
show you a slide of this, and let me show you that slide right now.
Sure.
So as you saw in this clip and slide, that this is the telemedicine hub set up in University of Health Sciences.
Okay.
That is where the doctors were paid and they were seeing, examining patients in different parts of the country. People who could not really get healthcare at all.
Wonderful. Well, I mean, it has been a wonderful like session. Would you like to tell us anything else that we have left covering? I mean, we can go on, and this is so interesting, but we just because the time that constraints of time, we have to wrap it up. So, any last words, Dr. Chuktai?
I just want to add two things. To me, telemedicine is a solution to many problems. And this was not only picked up by me, there were people who were noticing that around the world. And Professor Jay Sanders, he was the chairman of American Telemedicine Association,
Mhm.
did the foreword of my book, which is now available on Amazon. This book has been published, and it tells the story of telemedicine as a tool to fight pandemic. It's a 280
Yes.
pages book or 17 chapters. And
Yes.
then also I want to mention that the health TV channel formation in Pakistan, this is what I've
Mhm.
done in Pakistan, created a health TV channel. And that channel allows doctor to doctor communication, like medical education, then doctor to
Right.
public communication, so public education, then government to public and government to doctor health
Yeah.
policy
Yeah.
communication. And that channel is doing approximately 20 programs a month. And that is another way to
Wonderful. Yeah. Yeah, that I just like you, I believe in preventive medicine, and we can do so much educating the masses, and I think that is that could save so much like money and misery for the patients if we kind of deal with these situations before they really get out of hand. So I again, I mean, it was wonderful having you with us, Dr. Shuktai. It was a very, very informative and enlightening session. And I also want to thank the audience for listening to us, and we'll hopefully uh, get you some more interesting programs down the road. So thank you for your time, Dr. Shuktai, and we appreciate you coming to our program and telling us about your amazing, amazing projects and telehealth system. Thank you.